everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Les porte-parole aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'Honorable Blaine Higgs. Premier ministre, Dr. Russell.
Good afternoon. Bon après-midi. Je débute toujours aujourd'hui en disant merci. Je remercie tous les citoyens du Nouveau-Brunswick qui respectent les recommandations et les consignes de la santé publique. Je tiens aussi à remercier tous les citoyens du Nouveau-Brunswick qui ont fait des sacrifices personnels pour se protéger et protéger leurs familles. Je remercie également tous les citoyens de la province qui, avec gentillesse et empathie, encouragent leurs amis et leurs voisins à faire preuve de prudence et à demeurer vigilants. I want to thank every New Brunswicker who is following public health recommendations and guidance. I want to thank every New Brunswicker who has made personal sacrifices to keep themselves and their families safe. I want to thank every New Brunswicker who is urging their friends and neighbors with kindness and empathy to be cautious and stay vigilant. The measures that government has put in place over the last week need more time to work, but I see some hopeful signs. Case numbers in zones 1, 2, and 3, which moved to the red alert level on Tuesday, appear to be stabilizing, and that's good news. Hospital admissions for COVID-19 have also remained stable. But we are not out of the woods, not by a long stretch. As you know, the incubation period is 14 days, and so we are expecting to see more cases. La situation qui prévaut dans la zone 4, soit la région d'Edmundston et de Cranceau, est extrêmement inquiétante. Il y a présentement 112 cas dans cette région, ce qui fait d'elle la région qui compte le plus de cas dans la province. L'éclosion s'est répandue dans des lieux de travail et des établissements résidentiels pour adultes, ce qui est extrêmement inquiétant. Les zones 1, 2, 3 et 4 demeureront à la phase d'alerte rouge du plan de rétablissement. Il y a moins de cas dans les zones 5, 6 et 7, soit le nord et l'est du Nouveau-Brunswick. Ces régions demeureront cependant à la phase d'alerte orange pour empêcher la propagation du virus responsable de la COVID-19 en provenance de régions où cette maladie est plus répandue. The situation in Zone 4, which is the Edmundston-Grand Falls area, remains gravely concerning. The outbreak has spread into workplaces and adult residential facilities, which is deeply worrying, and the conversations that we've had around risk assessments and ongoing surveillance of the information that it's coming in, that as it's coming in, is very concerning. There are 18 new cases in Zone 4 today, of which 6 are linked to the Nadeau poultry plant. 24 of the region's 112 active cases are directly linked to this workplace, which remains closed. Zones 1, 2, 3, and 4 will remain at the red alert level. Zones 5, 6, and 7 in northern and eastern New Brunswick are seeing fewer cases, but these regions will stay at the orange alert level to prevent the spread of the virus from other regions where COVID-19 is more prevalent. We are prepared to give these restrictions time to work, but this pandemic has shown us time and again that time is not on our side. If we wait too long, we will find ourselves overwhelmed with hundreds of new cases, as is happening now in Maine, Quebec, and Ontario. And again, with travel, we will always see travel-related cases, and as the numbers continue to increase all around us, the risks will continue to be higher, as well as with the continuing risk of the UK variant arriving at any time. When it is required, we will be ready with new measures to further slow the spread of this virus, and we will not hesitate to recommend their use. Aujourd'hui, j'annonce qu'il y a 33 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick. Il y a 5 nouveaux cas dans la zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick. Dans la zone 2, qui comprend les comtés de Saint John, Kings et Charlotte, il y a 3 nouveaux cas. Dans la zone 3, soit la région de Fredericton et de la vallée de la rivière Saint-Jean, il y a 4 nouveaux cas. Dans la zone 4, comme j'ai mentionné déjà, il y a 19 nouveaux cas. Il y a 2 nouveaux cas dans la zone 5, soit la région de Campbellton-Restigouche. Ces personnes s'isolent à l'heure actuelle et la cause de ces nouveaux cas fait l'objet d'une enquête. Nous avons signalé plus de 10 nouveaux cas par jour depuis le 4 janvier et plus de 20 cas par jour tous les jours depuis le 14 janvier. Il y a maintenant 324 cas actifs de COVID-19 dans la province. De ce nombre, 3 personnes sont hospitalisées après avoir contracté la COVID-19, dont 2 aux soins intensifs. Today, there are 33 new confirmed cases of COVID-19 in New Brunswick. In Zone 1, which is Moncton and southeastern New Brunswick, there are 5 new cases. In Zone 2, which is Saint John, Charlotte, and Kings counties, there are 3 new cases. In Zone 3, which is Fredericton and the Saint John River Valley, there are 4 new cases. In Zone 4, as I mentioned, there are 19 new cases. In Zone 5, which is the Campbellton-Restigouche region, there are 2 new cases. These individuals are all self-isolating, and the cause of these new cases remain under investigation. We have reported new cases in double digits every day since January the 4th, and more than 20 cases every day since January 14th. There are now 324 active cases of COVID-19 in New Brunswick. There are 3 patients now in hospital, of whom 2 are in intensive care. Again, I ask you to keep all New Brunswickers whose lives have been impacted by COVID-19 in your thoughts and prayers as you go about your day. Public Health has declared an outbreak at Le Pavillon de Royer, a special care home in Edmundston, following a confirmed case of COVID-19 reported on Wednesday. Members of the Provincial Rapid Outbreak Management Team are on site providing support for residents and the facility's care and management team. And I have to say, the prompt team has been outstanding. Each and every time there is an outbreak in a long-term care facility, adult residential facility, etc., they are there to respond, and they have been doing a fantastic job. Prompt team is also at Manoir Bellevue, a special care home in Edmundston. An outbreak at this home was declared following a confirmed case of COVID-19. I am pleased to report that the outbreak at Parkland Riverview's Canterbury Hall has been declared over, as there have been no new cases there in 14 days. Residents of Canterbury Hall will be vaccinated today. Over the course of this pandemic, we have responded with measures aimed at keeping New Brunswickers safe. We have modified and amended our measures as we have learned about this virus, and we strive to recommend actions based on facts and evidence. And I know that it seems confusing sometimes when things change, but they're based on the new information that we have. We learned in the early days of the pandemic about the consequences of a full lockdown, our economy, and the mental health and well-being of New Brunswickers. We have revised our strategies so that the spread of the virus can be controlled with the least amount of disruption possible to our lives, but it still is disruptive, and it will be. Guidance for the red alert level has been modified to allow most businesses to remain open and for students to remain in their classrooms, and we believe that this is the best approach for our province. Les recommandations associées à la phase d'alerte rouge ont été modifiées pour permettre à la plupart des entreprises de demeurer ouvertes et aux étudiants de demeurer en classe. Nous croyons fermement qu'il s'agit là de la meilleure approche à adopter pour notre province. Relying solely on locking down our province is not as effective as prudent measures applied decisively, in the right places, and at the right time. But when it becomes necessary, we will not hesitate to recommend moving back to a lockdown phase. When we see widespread outbreaks and sustained intensive community spread where cases cannot be tracked back to an identified source, a lockdown strategy will become necessary. The lockdown phase will look a lot like what we all went through in March and April of 2020. New Brunswickers will be urged to stay at home as much as possible and limit their close contacts to their single-family bubble. Travel will be discouraged both inside and outside the province. There will be strict rules for self-isolation by travelers returning to the province. Une phase de confinement ressemblera énormément à ce que nous avons vécu en mars et en avril 2020. Nous encouragerions les citoyens du Nouveau-Brunswick à demeurer à la maison autant que possible et à limiter leurs contacts étroits aux membres de leur bulle d'un seul ménage. Il sera fortement déconseillé de voyager tant à l'intérieur qu'à l'extérieur de la province. Des règles rigoureuses sur l'isolement seraient imposées aux voyageurs qui reviennent au Nouveau-Brunswick. Indoor public gatherings of all kinds will be restricted. Funerals, weddings, and other celebrations will have to be postponed. No one wants to see this happen, and I sincerely hope we do not get to this stage, but we will be ready if and when that happens. We will not delay our actions while the virus overtakes us. This pandemic has taught us that our circumstances can change with frightening speed. We must be prepared to head this off before our situation becomes critical. Again, with the rising cases all around us globally, in the US, in Maine, and with the risk of the UK variant arriving at any time. This is why every New Brunswicker needs to wear a mask when they're out in public and maintain 2 meters of physical distance between themselves and others. Cette pandémie nous a appris que les circonstances peuvent changer à rythme alarmant. Nous devons être prêts à prendre contrôle de notre situation avant qu'elle ne devienne critique. C'est pourquoi chaque citoyen de la province se doit de porter un masque en public et de se maintenir à une distance de 2 mètres des autres. We all need to wash our hands regularly and thoroughly and disinfect surfaces. We all need to stay at home when we don't feel well and seek testing when COVID-19 symptoms emerge. This is the most important thing that we need to do as a province right now. Every single citizen needs to get tested if they have a symptom, and they need to stay home. Do not go to work, do not go to school. Again, I thank every New Brunswicker who is taking this pandemic seriously. You are helping to keep your family safe. You are working to protect our healthcare system and our most vulnerable citizens. You are protecting our vaccine rollout plan. You are protecting us from having an overwhelmed healthcare system, and you are saving lives. Please keep up the good work. Thank you. Please continue to work with us, and we will get through this together. Thank you.
Bonjour, good afternoon. The pandemic continues to test our resolve. It has, however, also revealed a strength we may not have realized we had. We have done hard things, and we will continue to do hard things in the days ahead. Nous le ferons parce que nous savons que c'est nécessaire pour assurer la santé et la sécurité de notre famille, de nos amis et de nos communautés. Mais cela ne veut pas dire que ce serait facile. This is a challenging time for our province, without question. Right now, Zone 1, the Moncton region, Zone 2, the St. John region, and Zone 3, the Fredericton region, are all at the red alert level. However, we are seeing signs of progress. It is our hope that this will continue and we can move these zones back to orange. If we continue to focus on protecting each other, we could move these zones to orange in a matter of days, not weeks or months. But that is dependent on each and every individual doing their part and the trends continuing to improve. Zone 5, the Campbellton region, Zone 6, the Bathurst region, and Zone 7, the Miramichi region, will remain in orange until we see further progress, but particularly further progress as it relates to the surrounding red zones. The area of most concern, however, is Zone 4, the Edmonton region. We have discussed the possibility of going into a complete lockdown in that zone if it is necessary. It would be similar to what we saw in March of 2020 when the entire province was in shutdown. Nous allons continuer à travailler avec les représentants de la santé publique et suivre le Conseil dans ce dossier. Tout le monde a un rôle important à jouer pour nous aider à ramener notre province dans la phase jaune. While we can make the rules and enforce them to the best of our ability, the onus falls on every New Brunswicker to do the right thing, to follow those rules and keep their family, friends, and community healthy and safe. Tickets have been used as a tool, with enforcement officers trying to educate people around the mandatory order instead of issuing tickets. That's been our goal, but we must use all tools in the tool chest to be successful. Mais en raison de l'augmentation du nombre de cas récemment, il est important plus que jamais de suivre la règle. Il est essentiel de faire respecter ces règles pour assurer la sécurité de tout le monde. Department of Justice and Public Safety enforcement officers conducted 327 site visits between Sunday and yesterday. In that period, they issued 20 compliance orders, 20 tickets under the Emergency Measures Act, 23 work orders under WorkSafe NB, 12 orders under WorkSafe NB, 1 administrative penalty under WorkSafe NB. There were also 179 house visits made to persons self-isolating under the direction of public health between Saturday and yesterday. There were only 4 cases of noncompliance. We know that most people are following the rules, but we need all people to follow the rules. We cannot be complacent. We tried that. It doesn't work. We did that back during the holiday period. It only takes one careless act to impact the community, to impact the region, to impact the province. The rules are so simple. Restez dans le boule de votre ménage. Portez un masque dans l'espace public intérieur. Et portez un masque dans l'espace public extérieur si vous ne pouvez pas maintenir une distance physique de 2 mètres. Don't travel outside your region unless it is necessary to do so. Even within your region, keep travel to a minimum. Stay home as much as you possibly can. This is a critical time for our province. Even though the vaccines have started to roll out, we are in the most significant situation that we have had through this entire pandemic. More than 1,300 people are expected to receive their first dose of the vaccine at clinics taking place in the 10 long-term care facilities that begin Tuesday and are concluding today. So we will continue to roll out the vaccine in an expeditious manner as vaccines become available. Other clinics will be held for healthcare workers that will be taking place on Friday and Saturday in the Edmundston, Bathurst, Fredericton, and St. John areas. En raison d'une réduction temporaire du nombre de vaccins expédiés par Pfizer BioNTech, certains endroits ont dû réduire le nombre de vaccins qui seront administrés. Nous savons qu'il peut y avoir des retards. C'est pourquoi nous avons décidé, très tôt dans le processus, de mettre de côté un nombre suffisant de vaccins pour que toutes les personnes qui ont obtenu leur première dose puissent obtenir leur deuxième dose et être pleinement vaccinées. Même pendant cette réduction temporaire, notre plan de vaccination demeure sur les bonnes voies. The light at the end of the tunnel is visible. We've been talking about it, we've been seeing it, we've been hearing it. We know it's real. Vaccines are real. There are many that will be coming available in the coming months, 2 currently available. But we all need to be patient. We all need to be diligent. We cannot lose it in the last few weeks and months. We need you to follow the guidance of public health. This is a time for us to turn things around in our current outbreak and to reduce the spread. As Dr. Russell said, as I continue to say, as you've heard public health officials and people from all over the province, we will beat this virus, but we'll only do it if we do it together. And we'll only be successful if we stay diligent to the rules and we look out for one another. Thank you. Merci.
Merci beaucoup, Monsieur le Premier ministre. Dr. Russell, thank you, Premier and Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser votre question dans la langue de votre choix. Chaque journaliste aura une question. Et voulez-vous assurer de désactiver le son de vos micros? We'll now proceed with questions from the members of the media. Each reporter will have one question today. You have the right to pose your question in the language of your choice. And before we start, please ensure your microphones are placed on mute. John Chilbeck, Brunswick News.
My question is for the Premier. You're a snowmobiler and familiar with the sport. We've heard that a recent meeting of Woodstock snowmobilers near Fredericton contributed to the spread of COVID-19. If true, can you provide some details, and what would you say in general about snowmobiling while we're in red?
So I'm not familiar with that particular situation. However, any gathering of any kind, recreational, that would see people not following the public health rules would indeed be a problem. So I would say that whether it's snowmobiling, whether it's ATVs, whether it's walking in groups, whatever it is, you can't be together. You can't be in groups. You can't be stopping at warming huts and going to any sort of outdoor cookout. You know, in New Brunswick, in vast areas of open spaces, it's hard to tell someone that they can't go out in the woods on their snowmobile or on their ATV or taking a walk. But what we're saying is you cannot be in proximity with other people. You cannot expose yourself and others. And that applies certainly in red. It applies in orange. It applies to you know, our province right now in this pandemic. But I can't comment on that particular incident because I'm not aware of it, John.
Thank you, Premier. Before we start, there is a correction. I made a mistake myself. The actual number is 32 cases, not 33, as Dr. Russell, so that's my bad. Je m'excuse tout le monde, mais le vrai nombre de chiffres de nouveaux cas aujourd'hui, c'est 32. Ça, c'est la faute à moi, pas Dr. Russell. Vicky Hogarth, CHCO TV.
Thank you, Bruce. Dr. Russell, has there been any student-to-student or teacher-to-student transmission of the virus in the classroom setting yet? And are schools doing thermal imaging checks, temperature checks of staff and students? And maybe should that be mandated in the red level of recovery?
The first question, Vicky, around student-to-student transmission, I'm not aware of any, but that doesn't mean that it has not happened. The situations that I have been made aware of are those whereby adult to adult, whether it's a staff, whether, you know, whatever type of staff, student, or sorry, oh my goodness. I am only aware of adult to adult transmission among staff in schools or adult to child. I haven't been made aware of student to student transmission or student to adult. But that, again, that doesn't mean that it hasn't happened. I just haven't been made aware of it. And what I am aware of is that if there is any non-adult to adult transmission, it would be very, very, very little, because again, just in terms of what we have been given in terms of information, is that it's mostly adult to adult transmission. And the second question around, we have active screening for the schools. Oh, I might be thinking of the lockdown phase. I'm sorry. I'm going to go to my notes for just a second on the red phase with respect to schools. We're in meetings all morning, so my brain is full. Oh, okay. Okay, actually, I'm going to get back to you, Vicki, after the press conference. And, we're going to move on to the next question.
Natalie Sturgeon, Telegraph Journal.
My question is for Dr. Russell. The outbreak at Parkland St. John is continuing. 4 people have now died. The most recent identified case was yesterday. We know that visitors have been allowed in Howe Hall and Village Hall, at least under the orange phase. What does public health know about the index case in this situation, and why hasn't public health taken greater control over the facility that has been under an outbreak for more than 2 months now?
Well, with respect to who's in control of that facility, it is actually public health and the prompt team together that are working with social development and the owners of the facilities to control the situation. So with respect to visitors in the orange phase, I'm not aware of their policies around that. And certainly with the ongoing outbreak, it is, as I said, being managed in conjunction, like with partnership between public health, the prompt teams, which include Ambulance New Brunswick, extramural, and as well as social development. So there's quite a bit of work being done. And again, whatever happened with respect to visitation in the orange phase, I don't have information on that.
Thank you, Ms. Sturgeon.
Has public health identified the index case?
If it has, I'm not aware, but I'm not sure. I can find out, but usually, again, that would be something that we would be able to say it was related to travel or not. But at this point in time, I don't have that information.
Try to keep to one question each, please. Ms. Marie Sutherland, CBC.
Good afternoon. My question is for Dr. Russell. I'm wondering if you can tell me what specific scientific evidence was looked to decide that hairdressers, for example, salons could stay closed and non-essential retail would stay open?
So in terms of our risk assessments, when we were doing the planning around phases and triggers, early on in the pandemic, in terms of what risks those types of establishments would bring or not bring, were discussed. We know we have evolved quite a bit, and that's why in the orange phase they're allowed to be open. But at this point in time, when we were looking at the red phase restrictions, it was more around keeping people from moving around and wanting to limit travel as much as possible.
Laura Lyle, CTV.
Hi, good afternoon. This question is, I believe, for the Premier. According to a memo, teachers in schools where there has been a COVID positive case and refuse to be tested are being put on unpaid leave. I'm looking for confirmation of this, if this is the case, and if so, the reasoning behind this.
So I'm not familiar that is the case, but I would suggest that certainly anyone in that situation would be eligible for, taking sick time, or they would have leave that built up that they could use. So I would anticipate that it would be covered, and there wouldn't be a problem.
Thank you, Premier. Thank you, Ms. Lyle. Danielle Edwards, Canadian Press.
Hi, yes. I was speaking to an epidemiologist today, and he suggested that New Brunswick might be on a knife edge when it comes to getting COVID cases under control. I believe this question would be more for you, Dr. Russell, but do you think that you'd say the province is at a bit of a tipping point in terms of getting cases back to a place where they're more manageable?
Well, certainly at this time, Zone 4 is posing the most concern. We know that once the doubling time shortens to the point where you're doubling every day, then that's exponential growth, and we definitely don't want to see that. So we definitely are at a tipping point, there's no question.
Thank you, Ms. Edwards. Thank you, Dr. Silas Brown, Global TV.
Hi there. I'm hoping we can get a little bit more detail on what exactly the triggers would be for moving into the lockdown phase. Is it just widespread community spread, as was mentioned earlier, or what other triggers are you looking at here?
Hi, Silas. Our teams are working on that right now because we, again, we're seeing a very serious situation in Zone 4. And the orange phase didn't work around the province. The red phase, again, we might have to give it some time to see. But again, if the speed with which those cases keep doubling goes up the way we're seeing continuously, then obviously we have to do something more than what we're doing right now. So our public health team is working on that, and we're presenting to Cabinet tomorrow on that.
Thank you, Mr. Brown. Harry Forrestal, CBC.
Thank you, Bruce. Dr. Russell, we're hearing there's at least a single case and probably more at CFD Gagetown. Can you comment on the presence of COVID there and what steps are being taken to deal with it? For example, are troops being sent home?
I don't have any information on the Department of National Defense and CFB Gagetown at all.
Does it not fall within your remit as part of the province?
Well, Harry, again, Department of National Defense falls under the federal jurisdiction. We do have partnerships with and relationships with the base commander, but I will let the Premier speak to that.
Yes, I can speak to that. In relation, we've had different discussions with the commander, and also, you know, back a while ago, visited the site to understand their isolation protocols, which are very, very rigid. We know we've had a number of people come back after a tour and recently, and I do understand there's a single case. There has been a tracing done, and all members are on isolation at the base. And so it is well under control and checked, and they've been very diligent to follow the rules, and I would dare say we have a pretty high confidence level of their ability to contain it.
Alexandre Boudreau, l'Acadie Nouvelle.
Oui, bonjour, ma question est pour le Premier ministre Higgs. Je voulais savoir si un confinement ou un lockdown est mis en place dans la zone 4, est-ce qu'il va y avoir aussi un retour des mesures pour protéger les entreprises financièrement ou pour protéger les gens qui louent un logement, comme par exemple une protection contre les expulsions?
Yes, we'll be looking at all aspects of what the fallout is of a lockdown. So number one will be the decision of the necessity to do so. And I think, judging from the comments you've heard today from myself and Dr. Russell, that we're going through all of the analysis that's appropriate to determine that. But it does look likely. They will look at the impact on businesses. We did put a program out a few weeks ago in the case of businesses that had spent a lengthy time in orange or red. This obviously goes the next step. And we will look at the fallout and be looking to protect individuals and anticipating that certainly in the case of landlords and tenants that, there's a real understanding that this is no time to be evicting anyone when you get into particularly a lockdown situation.
Merci, M. Boudreau. Meg Cunningham, CHMA.
Good afternoon. My question is for the Premier. Some people in Zone 1 have been denied entry into Nova Scotia for their medical appointments, but are still allowed to travel in and out of red zones within the province for medical reasons. Why are people being denied entry into Nova Scotia for their appointments?
So I'm not familiar that people are being denied to go to Nova Scotia for their appointments. Currently, we have a policy that has everyone who's coming back into New Brunswick, no matter where they're coming from, going through an isolation of 14 days. So if there are particular cases where someone's being denied to go, we would like to know that. We'd like to have them particularly report that, because if someone has a medical appointment that is certainly of any sort of urgent nature, we would endeavor to help them to see that they would be able to keep it.
Thank you, Premier. Thank you, Ms. Cunningham. Jean-Philippe Hugues, Radio-Canada.
Bonjour, j'aimerais avoir plus de détails sur la situation à l'hôpital d'Edmundston. Il y a au moins un cas infecté à la COVID-19, un travailleur. Est-ce qu'il y en a des nouveaux? Qu'est-ce qui est en place pour le dépistage dans l'hôpital en ce moment?
Hugues, peux-tu répéter ta question?
I don't know who was asking.
Oui. Donc, on a confirmation qu'il y a un travailleur de l'hôpital d'Edmundston qui est infecté à la COVID-19. Est-ce qu'il y en a des nouveaux aujourd'hui et qu'est-ce qui est en place pour dépister? Qu'est-ce qui est en place pour protéger les patients?
So my understanding is that extra testing is taking place all over that region. I don't have specifics on healthcare workers other than the staff and patients that would be tested at the long-term care facilities. And in terms of healthcare workers impacted by COVID-19, it's broken down by Vitalité and Horizon, and they tell me the number of healthcare workers having to either self-isolate or are infected in a total number on a daily basis in terms of the impacts to hospital service delivery.
Can you say it in French?
Ah oui, je vais répéter en français. Alors, ce que je comprends, c'est qu'il y a Il y a beaucoup de gens qui sont en auto-isolement en ce moment-ci ou sont positifs pour le COVID-19 dans Vitalité et Horizon au niveau des impacts sur les employés. Puis il y en a 76 qui ne peuvent pas présenter pour le travail aujourd'hui. Et ça, ça cause des impacts sur les services de santé. Mais au sujet des gens qui se font tester, à ce moment-ci, il y a plusieurs endroits qui font des dépistages et en général, il y a une augmentation de dépistage pour toute la région.
Merci, M. Hugues. Adil Ibrahim, CBC.
Thank you. This question is for Dr. Russell. There's a new case at a long-term care home in St. Basile. My understanding is that those residents were vaccinated in early January. How many of those residents were vaccinated? What does this say, if anything, about how protected they are, and what impact will this case have on their second dose?
Number one, I don't have the dates in front of me of when the different care homes have been vaccinated. And what I can tell you is that whatever the date is, if a person has been vaccinated, it takes 14 days after the very first dose to have an effect on your immune system. And then it requires that second dose for the full protection of your immune system. So first of all, I don't know if they've had their second dose, but certainly if that facility had been vaccinated and that particular individual had been vaccinated, the first dose does provide quite a bit of protection, but it has to be 14 days after you receive the vaccine. And all those details right now are under investigation.
Thank you, Ms. Ibrahim. Savannah Odd, Telegraph Journal.
Thanks, Bruce. My question is for Dr. Russell. The province's criteria so far for declaring an outbreak over has been 28 days or 2 incubation periods with no cases. And I say that based on your statements in November about Manoir Notre Dame and Moncton, and Parkland St. John has said public health gave them that 28-day timeline for declaring their outbreak over. So that said, can you tell me why Parkland Riverview's outbreak has today been declared over after only 14 days without a case? And does the change have anything to do with getting people vaccinated in that facility?
Well, I'm not quite sure. That is a very good question, actually, because I did notice that myself. But in terms of anything else on Parkland right now, I will probably have to get back to you on that.
Louise Rodriguez, Kilabash, Radio-Canada.
Oui, bonjour, Dr. Russell. Vous avez dit que les écoles restent ouvertes en zone rouge. Le gouvernement a répété que c'est l'endroit le plus sécuritaire pour les élèves, mais il y a plus de 20 000 parents qui ont signé une pétition pour fermer les écoles. Donc, peut-être nous expliquer pourquoi vous pensez que c'est le meilleur endroit pour les élèves et qu'est-ce que vous dites pour rassurer les parents qui s'inquiètent?
Alors, je comprends l'inquiétude des parents parce que je suis parent moi-même avec 2 enfants, 2 ados. Et les recherches que nous, à Santé publique, on fait pour nous rassurer qu'il y avait... c'est pas que le risque est 0. Le risque ne va jamais être 0 dans une pandémie. Ça, c'est la première chose. Mais quand on compare les risques de le COVID-19, dans la transmission entre les élèves, entre les adultes, etc., le risque pour le COVID-19 à ce moment-ci est moins que les risques qu'on va voir, les impacts négatifs sur la santé mentale, sur l'éducation, sur la sécurité de la nutrition et la protection des enfants. Alors, à ce moment-ci, basé sur toutes les recherches qu'on avait faites, c'est ça qui nous guide à dire que c'est pas que le risque est 0, c'est les risques des autres impacts négatifs sont plus sévères que le risque de COVID à ce moment-ci, et c'est pour ça qu'on a basé toutes nos décisions sur des recherches comme telles.
Merci. Tom Bateman, Brunswick News.
Good afternoon. I just want to follow up on Marie's question from earlier around transmission in restaurants and movie theaters. Dr. Russell, do you have any evidence that there has been transmission of COVID-19 in this province happening in places like hair salons, churches, movies, and places that have had to close in red? And so how often are we seeing those, given that they have to close?
So thank you for your question, Tom. The evidence in terms of salons, we do have some transmission happening. And we also obviously have looked at other jurisdictions as well in our risk assessment around that. With respect to movie theaters, cinemas, I don't have any information on that for New Brunswick. But certainly, again, when we base our risk assessments, the information that we are provided is a combination of things that are provided from the Public Health Agency of Canada, our conversations with the Special Advisory Committee, which I'm a member of, and also our own data. So it's a combination of many things, and including the fact that we know that the less people move around, the fewer reasons people have to go out of their home in terms of essential things, the better in terms of reducing the number of close contacts and interactions to prevent the spread of COVID-19.
Thank you, Mr. Bateman. Michel Corriveau, Radio-Canada.
Bonjour, ma question est pour Dr. Russell. Alors, Dr. Russell, vous avez souligné tout à l'heure que c'était une situation extrêmement inquiétante dans la région d'Edmundston. J'aimerais savoir quelle est la projection que vous faites pour les prochains jours et justement les prochains jours, peut-être les prochaines semaines, et qu'est-ce qu'il faudra concrètement pour que vous déclariez, recommandiez un lockdown dans cette région-là? Quelle étape faut franchir pour aller vers ça?
Alors, merci Michel. On a beaucoup d'inquiétudes, c'est vrai, à ce moment-ci pour la zone 4. Et on continue à surveiller la situation qui continue à empirer. Et l'équipe de santé publique ont des réunions aujourd'hui pour compléter l'information qu'on va utiliser pour faire la décision sur les déclencheurs, pour annoncer si une décision va être prise par le cabinet COVID-19. Alors, on va présenter nos informations demain et c'est le cabinet de COVID-19 qui va faire les décisions.
Merci, M. Corriveau. Jennifer Baza, CTV.
Good afternoon. This question is for Dr. Russell. Residents in the Sackville area have expressed some concerns about there being no local COVID-19 testing site, which is an inconvenience for some people, leaving them with the only option to drive to Moncton to get tested. Because of this, is there a plan to set up a testing site in Sackville or other rural areas of New Brunswick anytime soon?
Yeah, these conversations have been happening for a little while now around setting up extra assessment centers. So the RHAs have been working with us, and we are looking at 4 or 5 more locations, and one did open today in Clare.
Thank you. Bobby Jean McKinnon, CBC.
Yes, thank you. I understand about 100 teachers at Riverview High were directed to attend the school today to provide distance learning after a positive case was confirmed at the school yesterday. Dr. Russell or Premier Higgs, can you please explain why the teachers need to be at the school when they've been set up to teach from home since the fall? And when is testing at the school supposed to begin?
Well, the fact that the schools are closed for 3 entire days allows for the contact tracing, it allows for disinfection, et cetera, and it allows for the testing to take place. So sometime over that 3-day period is when that would occur. I can't speak to the details around the specifics, but I know that the operational plan for EECD does have that in the plan that the teachers would be at school.
Thank you, Ms. McKinnon. Aiden Cox, Brunswick News.
I'm sorry, my question was, why do they have to be at the school to provide the online learning when they're set up to do that from home?
Well, I don't have all the details on that. Again, it was in the operational plan with EECD that was worked on with Public Health. But the other aspect that's really important is that the staff have to be tested.
Thank you. Aiden Cox, Brunswick News.
Hi, good afternoon. This question is for Premier Higgs. What is the estimate for how much money the provincial government is losing in revenue on a weekly basis as a result of these 4 zones being in the red? And is the province still on track to posting a $183.3 million deficit by the end of this fiscal year?
So I can't currently, I don't have let's say, any numbers in relation to the current red zone and the impact on the financials. The last report we had for the year end was 183, but I would say that going into a red zone, going into these orange zones would have been after those estimates, and so it will likely be greater. Certainly, as I mentioned earlier, about providing compensation packages for people that are impacted, businesses that are impacted, employees, because of these orange, extended orange or red. We will be looking at that to do what's right in order to make sure people have adequate resources. So yeah, the deficit situation is a bit of an unknown at this point, but I would say it's likely to be higher than its last forecast of 183.
Thank you. Clara Pasica, Times and Transcript.
Good afternoon. My question is for the Premier. Premier, in a recent poll, New Brunswickers indicated that they thought you were doing relatively well managing the pandemic, but you received one of the worst compassion scores of any Premier in the country. In a crisis, continuing to connect to get buy-in from residents could be considered a central role for any leader. So what is or will be your response to these results?
Well, I'm obviously disappointed that that would be, the outcome. However, throughout this process, I've tried to balance what we need to get through this as individuals, as a province, so that at the end of COVID, which we do see the end in sight, we actually have a province that can survive and provide employment, and we have a situation where people are looking to us as a refuge, not only in the health concerns, but they're also looking as a refuge of a safe place to visit, to invest in, or to live in and move here. I think we're seeing signs of that because we have a balanced approach to the pandemic. We've had very great success thus far, and I'm looking forward to continuing that, working closely with public health and my colleagues in the other parties. So, I guess we'll measure performance on actual results, not opinion. I feel confident that at the end of the day, we're going to look back on this and say, New Brunswick came through this in a way like no other province, because we got a province left when we actually got through COVID.
Thank you, Ms. Pasica. Nathan DeLong, Miramichi Leader.
Good afternoon. My question is for Dr. Russell. Community leaders in Miramichi have been saying that public health has advised them that testing in Zone 7 needs to increase for that zone to return to the yellow phase. What is the province's plan to increase testing in the region or encourage more people to get tested?
Well, as of right now, our message has been pretty consistent across the province that if you have symptoms, even if it's one symptom and even if it's very mild, that you should get tested immediately and self-isolate. So, when we see numbers not very high in a certain area, I can't imagine that they are not experience any symptoms whatsoever. But certainly we do have mechanisms for targeted approaches with comms to do that encouragement piece. But certainly my message today across the province is please get tested even if you have one symptom and even if it's mild.
Thank you. That concludes today's update. Thank you very much. Voilà la fin de notre mise à jour. Merci beaucoup.